Again, it's very early in the investigation. There's a lot of information to be sifted through. I don't know at this point of any comments directly made by the shooter to anyone in the clinic.
Could you say what his motive is? Could you speak to that at all? It's not a nexus of domestic terrorism. What is it?
The history that we have as a department with this individual makes it most likely that this incident was targeted at that facility or at someone within that facility. We're working now, as has been said, to make sure that we throw a net over anything remaining. We want to retrace his last hours and determine where he was. But at this point, because of the contact that we have had with him and his familiarity and a history of conflict, that's where we base the belief that this wasn't isolated and only directed at that facility or people within that facility.
Can you talk a little bit more about that, Chief? Jessica Miles of Channel 5. Because it sounds like the other clinic in town too was familiar with this guy, and they had a mug of him, and they knew who he was.
Correct. He has lived in this community for quite a long time, and has had contact with healthcare within the community during that time. None of the information that we have, again, it's early on in the investigation, but none of the information that we have from our past contact with him would indicate that he was unhappy with or would direct his anger at anyone other than people within the facilities where he had been treated or where they had attempted to give treatment.
Was there a doctor in particular that he was focusing on?
Again, at this point, it's early on in the investigation, and so that's not something we're going to talk about.
Were there any bombs or explosive devices detonated? Because the way those windows went out, it doesn't necessarily look like gunshots.
Again, one of the things that we want to do is make sure that when we give you information, it's accurate. In a scene like that, as soon as we rendered aid and were able to make sure that there was no one else in that scene that needed our help, we backed out, evacuated the area as best we could. So again, that answer is one that we would hope to answer. That question is one that we would hope to answer in the coming days, but it's too early to tell.
How many shots were fired?
I have no idea.
Can
Sorry.
you just address the explosion or whatever you're looking into? Because throughout the day we've talked about a shooting and then a half an hour later an explosion. So if it's wrong, can you say that that's wrong?
I can say that that's wrong. I know that the call came out at 11:54.
10:54.
I'm sorry, 10:54. Sorry. And when I talk about an evacuation where law enforcement had at that point backed out, I don't have a specific time, but I know that no more than an hour had passed.
And there was no explosion inside that building?
There may have been prior to our being able to go inside and evacuate the building.
So you can't confirm it right now until
correct.
they're done looking through
Correct.
it.
Can you talk a little bit about the people in the facility, in the clinic? Were they running out when this was happening? Were they sheltering in place? Were they hiding? What was staff and patients doing inside there? Do you know?
Yeah, so there is a lot that's unknown. All of the people within the building that we were able to speak with, we have spoken with, but that information again has to be part of the total investigation. In terms of people running out or what the reaction was, I know that Allina has a very comprehensive training response plan for things like this as a facility, and so I would guess, it would be a guess, that there was a combination of responses by people, whether they were sheltering in place or trying to exit the building. I'm sorry.
Can you talk